Good evening everyone. This is Dr. Rajaram from Sri Raghavas Physio Clinic. If you have recently suffered from Chikungunya or dengue, you might still be experiencing lingering joint pain. Today, let us discuss on what happens in Chikungunya and dengue and the reason for your joint pains and how you can accelerate your recovery from these pains and the role of diet in this recovery process. Chikungunya and dengue cause a lot of joint pain, muscle weakness and fatigue, and these symptoms stay on for months together, and in few cases we have seen these symptoms last even for years also. Chikungunya and dengue often leave patients with severe joint pain, muscle weakness and fatigue even after the fever subsides, and this is where physiotherapy comes into play. Let us discuss about what happens to body during chikungunya and dengue, why you experience the joint pains and muscle weakness and fatigue even after the fever subsides. Once a person is infected with this chikungunya or dengue, and once that virus enters the body, as a natural response, body releases certain cytokines and TNF alpha, that is tumor necrosis factor alpha, into the blood. So their primary goal is to basically fight off this viral infection. So imagine, say for example, we have terrorists intruded into the country. What will the government do? It will release a military. Similarly, these cytokines we are talking about are just like military. The only problem here is, as military is supposed to attack the invader, now imagine the military is attacking our own country people, and this is what happens. On one side, the cytokines will start fighting the viral infection, but because of less studied effects that are happening in the body, they start attacking our muscles and joints. In case of chikungunya, what happens is, so above the bones we have something called synovium, and these cytokines go and attack those synovium. And in fact, research has found out striking similarities between chikungunya, post chikungunya joints and rheumatoid arthritis. Rheumatoid arthritis, you all must be knowing, it's a autoimmune disease where our own immune system starts attacking our joint linings. Similar thing happens in chikungunya. Alright, in dengue what happens is, so the cytokines that are released in response to the dengue virus, they start attacking the muscle tissue directly, and also the immune system that is fighting off this viral infection also attacks the muscle tissue. As a result, the person ends up feeling extremely tired and develops severe muscle weakness. So now we understood this mechanism, right? So this is half of the equation, wherein because of the infection we are having this immune system attacking our muscles and joints. And just like imagine, recently Telugu states we have had a lot of floods and storm, right? So this viral infection is like a storm. So as much as we struggle a lot during these storms to just safeguard ourselves, but actually lot of work both for the government and for the public actually starts after the storm. So in chikungunya and dengue also similar thing happens after the infection is worn out. So like in case of a flood, what happens? Area is affected with floods, you will have to deal with the cleaning of the debris, and then we have to restore the normal life, right? So in dengue, this leads to muscle weakness, and that is the reason dengue is also called break bone fever, wherein the patient experiences pain similar to how we experience pain when the bone is fractured. So this is done, and then the storm is cleared. Now the body has to repair itself. So as it is during the infection, the body is struggling really hard to fight off the virus. As a result, the person develops a lot of fatigue, and you have joints and you have muscles that are affected because of this virus. As a result, post the infection, you have a lot of work that needs to be done. Basically, our goal is to restore the normal life. So imagine the case of a storm or a flood. So initially you have to clean up all the debris, and then in a systematic fashion, first you have to restore the ability to prepare food, and then you have to make sure sanitation is taken care so that the infections will not spread, and then you have to make sure water is the water that is being supplied is sanitized. So one after the other, and then once the power lines are all cleared, you have to restore the electricity. So there is a systematic fashion that needs to be done, and same thing happens in dengue and chikungunya also, where physiotherapy plays a very crucial role in putting these things in a systematic fashion. What comes after, what comes first, what comes next, and all these kind of things. Now we'll understand the role of physiotherapy. As we were discussing the example of storm, after the storm you have a lot of cleanup that needs to be done, which usually takes longer time, right? So in physiotherapy also, So basically these are the 6 areas where we help the patients recover from this illness. The first part is pain management. As the infection is happening, usually if you have visited a doctor, he already gives you some, we call NSAIDs, non-steroidal anti-inflammatory drugs. So that is during the infection, but once the infection is done, you are still having the pains. The reason being, there is inflammatory response still happening in the joints and muscles. So in physiotherapy, we use these electrotherapy modalities which primarily work on the joint without impacting your digestive system. So that is the first part. And once pain is controlled to a significant level, then we progress on to the muscle strengthening part. And this is where the expertise of physiotherapy comes into play. Why? Because if you start any exercise, every exercise, if the muscle is not able to take, that will end up damaging the muscle more than helping it. So there is a systematic sequence of exercises. If we discuss technically, it will be difficult for you to follow, but a well-knowledged and well-versed physiotherapist will be able to guide you through this muscle strengthening. And then the muscle strengthening, once we have achieved a significant level, then we will focus on to the joint mobility. Because of fever, because of weakness, you have already limited yourself into the way you are moving. So as a result, you will develop some joint stiffness also. So as we come to the point of joint mobility is where we help the patient regain their range of motion in the joints. And then we go into postural correction. Why postural correction in Chikungunya and dengue patients? See, as we were discussing, your body is using all the reserves to fight off the infection. As a result, all the major muscles that support your posture, they develop weakness, and few times they are going to atrophy as well. So we identify these unhealthy postural patterns and we help the patient correct their posture. And then comes the important part where we help the patient restore their energy. What do we mean by restoring energy? Post these infections, patients' activity tolerance becomes significantly low. Imagine they were working hour and a half or 2 hours in the kitchen. If you are a housewife, you are able to work for an hour and a half or 2 hours in the kitchen, making sure breakfast is ready, lunch is ready. After these infections, that time comes down drastically. Again, we identify the areas where you would like to improve yourself, and then we develop skilled exercises so that the energy is restored. And then once we follow all these 5 in a systematic fashion, that will lead to swelling reduction. There is a reason why we kept this in the last manner, because we have to address these patients in 2 important manners. One is addressing all these things, this so-called physical symptom. But along with this, we also have to systematically tell the body that now the storm is over. All right, storm is over and it is safe for you to move out. And that happens in a systematic fashion. So long we do not put that message in a sublime fashion into the subconscious mind, the swelling response keeps happening. And this is where the people, the patient keeps getting frustrated. So if somebody keeps on going and addressing this reduction of swelling, which is by using medicines, and you don't address this, the body is still in the protective fashion, defense mode, where it thinks that the movement is going to cause you more damage. So once we follow these systematic fashions, automatically swelling reduces in a very organic fashion and in a sustainable fashion, and that is how we help. Now comes the most important thing, that is diet. This forms a very significant role. Like 50% is physiotherapy, 50% is diet. This is what we tell all of our clients also. In diet, let's talk about don'ts. I always talk about don'ts first, because if you have taken care of this, 70% of the problem is covered. If you are South Indian, you are following a typical South Indian diet, avoiding these kind of things. Even if you don't pay strict attention to do's, you are okay, because most of these things are already included in our traditional food. So the first part is don'ts. So brinjal, most common thing. See, like we were discussing in the causative mechanism of Chikungunya and dengue, they follow a similar path line. That is, their pathomechanism is similar to rheumatoid arthritis. So similar kind of foods we want to avoid here. That is, foremost thing is fermented food. You want to avoid fermented foods. What is fermented food? Fermented food is topmost on the list is alcohol, and then curd, and then dosa. So dosa also, if you are making with fresh batter like pesarattu and all, you will be all right. But if you are eating 2-3 days old batter and then you are making dosa out of it, you should not eat that. And fried food, you want to avoid fried food. And then brinjal, fish, red pumpkin. These are the important things. And fermented food also includes your bread, because unless you ferment the dough, it doesn't become bread. So you want to stay away from all bakery products also. That is don'ts. So if you, like I told you, if you follow this, if you don't pay attention here, you will still be okay so long you are following traditional South Indian food. So let's talk about do's. So the most important thing is hydration. Few clients we notice, because their energy levels are so low, if you drink a lot of water, then you have to make frequent trips to the bath. Because they don't even have that much of energy, they keep avoiding, and that ends up in a vicious cycle. You are not drinking enough water, your energy levels are not getting restored, therefore you are not going to washroom, not drinking water. So you have to break that cycle. So drink lots of water. And if you don't have really taste, and if you want to eat very less, two things you can try. You can take, and if you don't have diabetes, then you can take fresh coconut water, or you can take electrol powder also. Hydration is very important. And second part is protein rich food. This is the most favorite topic of all the people these days. So protein rich food means immediately we think about fish, non-veg and all these kind of things. No, when you are recovering from chikungunya and dengue, the proteins you want to focus are simple to digest proteins. That is again our traditional food, moong dal, tuvar dal, in the form of dal, pappu we call, right? So if you take that, that is easy for the body to digest. So if you take care of that much of protein, that is good enough. Homemade ghee is also good, you can take that. And the third part is anti-inflammatory foods. Yes, you heard it right, anti-inflammatory foods. We do have them in our cuisine, that is your ginger and turmeric. They are naturally anti-inflammatory. So include them in your diet. It doesn't mean eat a lot of it, but eat in good proportion. And then vitamin C and zinc. So again citrus fruits and then nuts. So whenever you are taking nuts, you have to make sure they are soaked, otherwise your body will not be able to assimilate. Recovering from chikungunya and dengue, your appetite is already low, and so is your digestive system. Again, all the resources have been used to fight up the infection, right? So the digestive system also slows down. So the concept you want to keep in mind is easy to digest and simple foods. Those you want to eat, keeping these kind of things in mind. So basically protein rich, anti-inflammatory and all these kind of foods. So if you take care of these things and then follow a structured, systematic exercise program, you will recover fairly fast. Otherwise the quality of life goes down, and then it takes really long time for you to regain your active lifestyle. So even after fighting all these, if you would like to develop exercise program, you are more than welcome to visit our clinic, Sri Raghavas Physio Clinic. We are on road number 36, Jubilee Hills. Thank you very much.